Hello, I'm Wendy Terrell from Platform Q Health Education, and I'm here to present a scientific poster that was supposed to be presented at the ASCO 2020 live meeting, our annual meeting. And unfortunately, due to COVID-19, the meeting was canceled, but I'm very happy to be here today to share the results of this program. You'll also be able to see the program as a moderated poster session through the ASCO 20 virtual scientific program, which will be held the same dates as the originally planned live conference, May 29th through June 2nd. So please check out ASCO's website for that. So my co-authors for this poster are Tarika Akbarali from Platform Q, Eileen O'Reilly from Memorial Sloan Kettering Cancer Center, Matthew Alsante from National Pancreas Foundation, and Catherine Pucci and Elizabeth Del Nido, both from Platform Q Health Education. So this program was a patient and caregiver-directed online educational program. And it was focused on patients and caregivers, well, patients with pancreatic cancer and their caregivers. Those were the target audience for the program. And overall, we found a nice impact through this educational evaluation of the program, the impact that focused on improved knowledge, improved empowerment, improved alignment with the principles of shared decision-making, and improved communication with healthcare providers. So on this slide, we lay out the basic needs that were identified that led to the development of this program. So we really found that to close gaps that existed in engagement, in quality of life, in the existence of adequate shared decision-making, to address these needs, that education that stressed information about the basic pancreatic cancer facts, about diagnosis steps, about treatment and medical management and ways to minimize side effects and improve quality of life. Those were the gaps that we were trying to fill through this education. So the format of the program itself, it was initially live and online, and then later it was available on demand. So it launched in November of 2018 and stayed online until May of 2019. It was 1 hour in total, but it was chapterized into 4 distinct chapters that focused respectively on disease basics, treatment options, remission, and lastly, strategies to improve quality of life. So as far as opportunities for patients and caregivers to interact as they were engaging with the program, we had a question board that folks were able to submit questions to and upvote their questions before the educational program. There was also live Q&A and live polling. And faculty were able to comment on the results of the polling in a way to engage with the audience. So the panel included a physician, a nurse practitioner, and a representative from the National Pancreas Foundation as well. And importantly, there were patient vignettes that were included in each chapter of the program. And these patient vignettes were taped insights from patients talking about their journey, whatever alignment it was with the content of each chapter. So for example, the patients would talk about how they were diagnosed, some strategies they used to minimize side effects, etc. So the program was hosted on Cancer Coach Live, a patient and caregiver facing website, and also it was distributed through Facebook video.
I think that there are a number of concerns that many of us have about pancreatic cancer. The concerns relating to the impact.
And there are several examples of this. There is a setting where we know what the genetic risk in that family is.
If your family has pancreas cancer and you would like to know more about the disease, one thing I found really effective for patients is to join them in their doctor's appointments.
The side effects that I experienced from my surgery, I had some mechanical issues. And my body would act like it had a blockage when it really didn't.
You know, it was probably 6 to 8 months before I could really move around comfortably and feel like I was back, you know, to 100%.
Important to know that these are treatable. While they're a little bit of a scary thought, they are treatable, and they're effective medications with either injections, low molecular weight heparins, or now a new class of oral agents that we use on a regular basis.
Clinical trials are an option that really are very, very helpful for many patients who find themselves in that situation. A clinical trial is really a research study, but also it's sort of the most cutting-edge thinking about what may be available for you.
On the right of this slide, you could see our survey methodology, and this is our educational evaluation methodology. We had a pre-test and post-test, which were prior to and immediately after the education, and then a 2-month follow-up where we were able to ask more behaviorally focused questions. So we had over 6,000 caregivers and patients engaged with the program, and that includes both on Cancer Coach Live and through Facebook video as well. An average of 30 out of 60 minutes of learners in session when they viewed it on platform in Cancer Coach Live. And we have some behavioral impact questions here. So at the 2-month follow-up point, 46% reported feeling more in control of their healthcare decisions. And in the quote bubbles, you could see some feedback from the patients and caregivers regarding feeling more in control. And 33% reported that they experienced a positive communication improvement with their HCP regarding pancreatic cancer. And once again, you could see some quotes here from the patients and caregivers. So here we have some more results. So there were questions pertaining to shared decision making, and there was an increase post versus pre-education of support for principles of shared decision making. But 21% stated that they still don't need to speak with their HCP about their condition, that they really wanted to leave all of the decision-making to their healthcare provider, and were not in support of models of more shared decision-making. So we asked knowledge questions pre and post, and out of the 4 total questions, there was an uptick of the average pre to post correct answer choices, and at follow-up, you still see a maintenance of that increase over baseline. So in conclusion, we did find that this online patient and caregiver education yielded immediate and sustained gains in our educational goals, which included knowledge improvement, as said, about basic facts regarding pancreatic cancer, and improved empowerment and willingness to become more active participants in care. So thank you very much for joining us.